Welcome to the attendees that are just now arriving in Workshop 1B. Workshop 1B is Empowering Communities, Leveraging Community Health Workers to Address Social Determinants of Health Needs Across Diverse Settings. As we have our attendees streaming in, we are going to just take a few minutes to finish up our tech setup and inviting our interpreter into the interpretation room. So as you come on in, feel free to put in the chat your first name, last name, where you hail from, and what you're excited about learning today in empowering communities. We'll be back with you in just a few minutes. And for those that have just joined as attendees are streaming in, you are here at Workshop 1B, Empowering Communities, Leveraging Community Health Workers to Address Social Determinants of Health Across Diverse Settings. We are just waiting for our interpreter to arrive and get her settled into the interpretation room. This session will be live interpreted in Spanish. And so we'll get situated here and we'll get started at 4:15 Eastern Daylight Savings Time. And good afternoon again. For those that are inquiring about other time zones, we are currently at 4:13 p.m. Eastern Daylight Savings Time, and that will be 1:13 Pacific Daylight Standard Time, and we will get started in about 2.5 minutes. So just sit tight and we will be back with you. We are just awaiting our interpreter to arrive and be placed in the interpretation room. And again, this session 1B, will be interpreted in Spanish. So if you would like to listen in Spanish, we will get situated on the interpretation line here shortly. And to my presenters, we are currently at 34 attendees. And so once we get started with the interactive, if you would like to do individual interaction or global interaction, just let me know and I'm happy to facilitate.
Thank you.
All right, presenters, we are sitting at 37 attendees, now 38, and we are going to go ahead and get started. Our interpreter will be arriving shortly, and so as soon as she has arrived, I will let everybody know on chat that they can head over to the Spanish translation if they prefer the interpretation in Spanish. But we won't delay here, and we will go ahead and get started. So thank you all for joining Workshop 1B. I'm going to hand it over to our presentation team.
Great, thank you. Good afternoon, everyone. We are so excited to welcome everybody to today's workshop. As it was mentioned, it's entitled Empowering Communities, Leveraging Community Health Workers to Address Social Determinants of Health Across Diverse Settings. So really, first and foremost, I want to extend just a warm welcome to everyone who has taken time to join us today. I really truly believe that your presence here is a testament to your commitment to the work of community health workers. We're just truly so excited to have you guys here. So our goal is to provide you with valuable knowledge, practical tools, and of course, a platform here to share your own experiences and ideas. This afternoon, we have a really exciting agenda lined up filled with all kinds of different education, some light conversation, and some hands-on opportunities to really dive into our corner of the CHW world. But first, I'd like to go over just a few housekeeping items to ensure a productive time together. So first, please respect everyone. Please treat all participants with kindness and respect, and that's both presenters and audience. In that same token, I'd like to emphasize that this is a judgment-free zone, and we encourage everyone to share their thoughts, ideas, and questions, okay? Second, participation is incredibly encouraged. We believe that diverse perspectives lead to better outcomes. Your unique insights and ideas are so valuable to our discussion, so please feel free to speak up via unmuting or the chat function. And then finally, have some fun. Let's start with a positive mindset. Remember, we're here to learn and grow together, but that does not mean we can't have some fun along the way. All right, without further ado, let's kick off our workshop with a really brief overview of today's agenda, okay? So we're going to begin with an introduction of our speakers. Next, we'll dive into a brief history of community health workers, highlighting some of their historical impacts. Then we'll move into a discussion of health payers, and we'll start explaining what they are and how CHWs have established a really significant presence in that industry. And then finally, we'll wrap up the day with some inspiring success stories and a practice scenario. All right, please join me in giving a very warm welcome to the two lead speakers on our three-person team who will be offering their knowledge and expertise. All three of us come from what is called the Equitable Population Health Team here at Humana Healthy Horizons in Kentucky. So we support Humana's Kentucky Medicaid population, and we work on meeting all of their health-related social needs. We also work very closely with our community engagement partners to ensure that we're building a presence in the community and learning about the vital resources that we really need to be connected with to support our members. First, I'd like to introduce you to Rachel Hamilton of Lexington, Kentucky. She is a certified community health worker here in Kentucky who also has her master's degree in social work. We've been lucky enough to have her here at Humana for just under 2 years and hopefully many more to come. Rachel is a subject matter expert around several different topics. So those topics include sexual exploitation and trafficking, development of a variety of our Kentucky Medicaid marketing materials, and she supports our new associate training. So welcome, Rachel. And then next, I'd like to introduce you all to Megan Lee. So Megan is also a certified community health worker, and she lives in Bowling Green, Kentucky. She recently successfully completed her master's degree in public health, which we're all super proud of. Megan is also rapidly approaching her 2 years here at Humana, and she's just been such a true asset to our team. She brings a lot of specialized experience around evidence-based prevention, health education, refugee and immigrant populations, as well as individuals living with HIV and AIDS. And then y'all have myself, Alyssa Haters. So I am not actually a certified community health worker, unlike my fabulous team here, but I am the manager of our Equitable Population Health team here at Humana. So I have my master's degree in healthcare administration and my case management certification. And as I mentioned, I manage our incredible team of CHWs here at Kentucky Medicaid, and I've been just so lucky to walk alongside and learn from these really skilled individuals to better advocate for our program and the needs of our member population. All right, so let's chat a little bit about who CHWs are and what they do. Now, we assume that a majority of the folks on this call probably already have this context, but just in case, let's level set a little bit, okay? So CHWs are defined as frontline public health workers who bridge the gap between healthcare systems and communities, providing culturally appropriate health education, care coordination, and advocacy. So CHWs are especially unique though because of their ties to the communities that they serve, which allows them to build trust and communication between patients and their providers. CHWs have a very wide scope of responsibilities, including delivering tailored health education, assisting individuals in navigating healthcare systems, advocating for community needs, engaging with underserved populations to promote healthy behaviors, and providing emotional support to individuals facing a variety of health challenges. So given their extensive responsibilities, community health workers require comprehensive training and skills, as I'm sure most folks are very aware of. This training encompasses basic public health concepts, effective communication practices, navigating the complexities of the healthcare system, connecting individuals with appropriate resources, cultural sensitivity, and understanding social factors that impact health outcomes. So I think it goes without saying that the role of a community health worker demands just really significant dedication.
Good afternoon, everyone. So my name is Megan Lee, and I'm going to go ahead and just start with a brief history lesson regarding the development of CHWs, which began around the 1930s in China. So the farmer scholars emerged as assistants to physicians, especially around the rural villages where there were shortages of medical coverage. And then shortly followed after, the barefoot doctors become popular, still practicing in rural areas, but this time they had a little bit more training and expertise. So they were able to provide education on basic sanitation practices, provide basic medical examinations, and develop programs to reduce the spread of illness and disease. Moving forward to the 1960s, CHWs became popular in Latin America, in which they were able to focus their efforts on the community's strengths to help address access to healthcare, understanding health insurance, proper nutrition, and managing chronic illness. Moving to the 1990s, we saw a huge influx of CHWs around the world, offering their training in resource navigation and health education. And notably, in 2016, the Kentucky Association of Community Health Workers were formed, followed shortly thereafter by the National Association of Community Health Workers. And just to note a huge win for Kentucky, as of late, we now have 320 certified community health workers in the state. Next slide, please. So to talk about a couple of other big wins for community health workers. So in 2018, 7 out of 8 best practices for community health workers were included in the inaugural World Health Organization guidelines, which were marking a huge step in global health. In 2019, at the start of the pandemic, the CDC awarded over 116 million in the first of a 3-year, 348 million program, which offered support for CHW services in efforts for COVID-19 prevention and control. A few more notable wins happened last year in 2023 when North Carolina expanded their Medicaid coverage to over 600,000 residents. And in Kentucky, which is a huge win for especially us, Kentucky providers can actually now bill Medicaid for community health worker services. Next slide, please. So we especially focus on the social determinants of health here at Humana. So what exactly is a social determinant of health? They are non-medical factors that influence health outcomes, such as the neighborhood in which you live, where you work, how much income you make, your level of education, and your access to healthcare, such as having a nearby clinic or a hospital. The idea behind Maslow's hierarchy of needs, a motivational theory, is emphasizing that a human's most basic physiological needs, like adequate food, water, shelter, must be met before an individual's true and full potential can be achieved. And backed by the evidence from the CDC, social determinants of health have shown to have a greater influence on health than either genetic factors or access to basic healthcare services. So, for example, poverty is highly correlated with poor health outcomes and a higher risk of premature death. Next slide, please. So, moving forward with a little bit of some different roles that we play as well. Advocacy. So, advocacy means giving the people a voice, especially by empowering our members to help themselves by providing education, knowledge, and resource navigation. By addressing the social determinants of health, we can foster an environment where every individual has equal opportunity to the healthiest lifestyle that they can have. And by helping our members navigate the complex healthcare system, we can ease their burdens and eliminate any barrier they may face while trying to manage their health conditions. Next slide, please. So a benefit of CHW political advocacy includes seeing firsthand how well programs are working. And if we can recognize any improvement, then we can suggest the positive change to the right decision makers. Policy changes related to the SDoH, social determinant of health needs, address disparity, can target factors contributing to systemic public health issues, and influence positive community changes. CHWs can also advocate for policy change that influence the delegation of funding for programs, such as the Housing and Urban Development, commonly known as HUD, housing vouchers. CHWs can influence program development along with partnering with stakeholders, community partners, utilizing similar coalitions, and also participating as board members. So just to kind of put it into perspective, some policy change that has made health equity possible include a few of the following. The Affordable Care Act, which is more relevant to our situation as a health payer, has mandated affordable health insurance coverage for eligible Americans, especially based on income guidelines. And this is commonly known as Medicaid coverage through a managed care organization such as ourselves. Another one is the Fair Housing Act, which has been a huge step in housing as far as because it's prohibiting discrimination and accessing housing based on race, color, national origin, sexual orientation, gender identity, disability, and religion. The Americans with Disability Act has prevented the discrimination of those with a disability in everyday activities, such as parking accommodations, ramp and handrail accessibility, and assistive functions in public transportation. And just to name a couple of others, the Clean Air Act, which has declared all vehicles and engines operating in the United States to comply with certain emission standards, which has made cleaner and healthier air. And the Environmental Protection Agency banning the continued use of asbestos, which is a material commonly used in construction or labor-based jobs, which is known to be a carcinogen. So it has known to cause cancer. And the use of lead-based paint, which is commonly known to cause developmental delay and defects in young children. So I'm curious if you know of any other policy that you think has made a great impact towards health or health equity, feel free to throw it in the chat and give us some ideas. And next slide. So what exactly is a health payer? So community health workers within health payers play critical roles in navigating the healthcare system and addressing social determinants of health, as we mentioned. A health payer is an organization or an entity that pays for healthcare services, often referred to as health insurance company, which provides health plans for members. Humana Healthy Horizons is one of several health insurance companies in the state of Kentucky that offer Medicaid coverage. A member is a person covered under a health plan, which can also include as an enrollee or an eligible dependent as well. And a community health worker employed within the health payer, the insurance company, are such as myself and Rachel. And next slide. So it's important to note that Medicaid and Medicare are entirely different health plans, but are easy to confuse. Although Medicare members, which are those who are individuals with certain disabilities or seniors 65 and older, also can benefit from the use of community health workers, we're going to primarily focus on Medicaid coverage, which is a joint and federal state program for low-income individuals of all ages, because that's the demographic that we serve. And some quick facts. So in the state of Kentucky, Medicaid covers 1 in 4 adults ages 19 to 64, 4 in 9 children, 3 in 7 people with disabilities, and 45% of all births and 28% of the entire Kentucky population. Next slide. So how do we exactly, as a health payer, improve health outcomes? So a health payer, the insurance company, CHW, provides personalized support, health education, and connection of resources for an ultimate goal of improving our health outcomes for our members. And we can identify the members in need through a variety of channels, including health risk assessments, claims data, referrals, and pharmacy information. So on the next slide here, I'll go ahead and explain a little bit further about what these documents are. Next slide, please. So an HRA, or a health risk assessment, is an annual assessment that identifies members with high health risks or social determinant of health needs. So questions include information such as demographics, education, income, health conditions, medications, social needs, and for example, such as struggles with finances, housing, transportation, or more. So on the right there, I have included a picture of what our health risk assessment looks like, which we try to immediately fill out for all of our members just so that we can close any gaps. So for example, one of the questions says, what is your housing situation today? Do you have housing? Are you staying with others? Are you homeless? Are you unhoused? As well as if they don't answer that question, or if they want to answer further, then are you worried about losing your housing, such as maybe you can't afford your bills, or maybe you've had a prior eviction and you might be, worried about future housing or your current housing now. And then claims data. So these will highlight frequent healthcare utilizers and will identify members with certain diagnosis codes, especially related to specific social needs like housing. And we will go into this further, but a high utilizer is someone who frequently receives medical services, such as frequent emergency room visits, frequent surgeries, and more. And then we can also identify gaps from referrals from care manager teams, utilization management, community-based organizations, primary care providers, pharmacies, and more. And also frequently, our members themselves will actually call in and request for support. So whether they recognize that they have a healthcare need or they have a social need, then they will call in themselves and try to get our support as well.
Hi, good afternoon, everybody. This is Rachel Hamilton. So we're going to talk about value-added benefits. Value-added benefits are extra programs and services that address social determinants of health for our members. Health payer CHWs are unique in that we can utilize these programs as a tool to meet SDoH needs. I will go more in depth about some of these in the following slides, but our value-added benefits are designed to meet specific needs within the populations we serve. CHWs assist our members with criminal record expungement services, GED testing support, housing assistance, and our workforce development program. We can also refer our members to nurse care management when the member needs a remote monitoring device, such as a blood pressure cuff or a weight scale. And then we work closely with our Humana Beginnings team, which is our team that serves our maternity members. And our members can be eligible for baby and me meals, a convertible car seat, or a portable crib, and doula services. And then the other group we work closely with is our wellness team. We have coaches for tobacco cessation as well as weight management that we can refer our members to. Next slide, please. Humana offers several food and nutrition related benefits to our members. CHWs are a crucial part of addressing food insecurity that is reported by our members. Our CHWs refer and assist members with signing up for SNAP benefits. We provide resources for local food pantries and assist with transportation to obtain food. We also educate on our Kentucky Double Dollars program, which is a really cool program we have here in Kentucky where SNAP recipients can purchase fresh produce, meat, and dairy that is local Kentucky grown at their farmers markets. And for our members who have specific chronic health conditions, they can be eligible for a fresh fruit and vegetable box quarterly that can assist with their health goals and having balanced nutrition. And this is done through our nurse care management program. Next slide. As I'm sure many of you know, transportation is a common barrier with this population that we serve. This is a barrier we are constantly working to address. Currently, we have a couple different pilot programs going based around transportation. Our first pilot is called the Behavioral Health Transportation Assistance Pilot, and I know that's a mouthful, but this provides transportation cards or vouchers to members who are receiving services at 7 counties, which is a local community mental health center. And these can be utilized for follow-up appointments, lab work, preventative screenings. Our second pilot is called the Maternity Doula Dash Pilot. This is designed for our members who are pregnant or who are postpartum, and it operates similar to Uber or Lyft, but it utilizes doulas as the drivers. They can provide transportation to obstetrical and well child visits, WIC appointments, perinatal education classes. They also provide childcare while the member is in the appointment, as well as just general education from the doula in the car on the way there and the car on the way home. And then we also have our workforce development program, which is operated by my team in the CHWs. We can provide our members with 3 round-trip bus passes or transportation passes per month to assist them with attending interviews, meeting with a career coach, putting in job applications, anything that is geared towards finding employment or workforce development. And then we have our non-emergent medical transportation, and this is a statewide program for Medicaid enrollees without access to transportation, and it provides free transportation that helps the members get to and from their medical appointments as long as it's a Medicaid covered service performed by a Medicaid enrolled provider. And then lastly, we have our Go 365 rewards for transportation. So Go 365, we're going to get into on the next slide, but one of the rewards on there that our members can redeem is an Uber gift card, so they can kind of schedule their own transportation. Next slide. So Go 365. Go 365 is a wellness program in which our members are rewarded for engaging in healthy behaviors, especially preventative healthcare, such as breast cancer screenings, colon cancer screenings, diabetic screenings. Members can redeem these rewards in the form of a gift card towards anything that they would like, such as groceries, gas money, Uber, over-the-counter medication, household supplies. And this is incredibly useful for our members who live in rural areas who do not have a lot of community resources, do not have a lot of food pantries, clothing closets. They can redeem a Walmart gift card, and most places have a Walmart somewhere in reach. I want to share a recent example of how beneficial this program is. I met with a member who has 4 children, and herself and all 4 children are on Humana Medicaid, She was unaware of Go 365, and I went out to do a visit with her. We got her app set up, her and all the kiddos on there, and she already had enough reward money in her account to get Walmart gift cards to buy diapers for her youngest baby and school clothes for her older children. So this is something that I try, every member I talk to, I've tried to say, are you signed up for Go 365? Because this is one of the best services and benefits that I think we have for our members. Next slide. Addressing housing. All right, so Humana's approach to addressing housing needs first starts with identifying members who are unhoused or who are at risk of becoming unhoused. And similar to what Megan was saying earlier about how we identify members, it's kind of the same way for housing. These are identified through claims data. So if there's a diagnosis code related to homelessness that their physician files or a hospital, we can get a referral in that way. Some people may self-report. They can actually do their health assessments on Go 365. So they may get in there and self-report homelessness. We also have members who have been outreached by our nurse case managers and report to them that they may be unhoused or housing insecure, and we can get referrals that way. So it's a variety of ways that we identify these members. And then as part of our role as CHWs, we work to find potential partners within our communities who are addressing housing and addressing homelessness needs. We build partnerships with community-based organizations. We collaborate with our local housing authorities, and we advocate for additional revenue streams for housing programs. Our team also collects and maintains affordable housing resources throughout the state. We actually have an amazing group of people on our team all across the state. So if somebody doesn't know something, somebody does. And we keep a list of resources that we're able to provide to our members. And then one of our newest value-added benefits for this year has been our housing assistance benefit. Humana is now assisting eligible enrollees by giving up to $500 per enrollee per year to cover rent or mortgage, utilities, moving expenses. This program has been especially beneficial as well for our members who live in rural areas that have limited financial resources, and also very helpful for members who have fallen behind maybe just a month or two due to a hospitalization or a health condition, unexpected job loss. It's a way for us to kind of get in quickly and provide a little support. Next slide. So what makes a health payer CHW unique? So we offer support like any CHW. We provide health education. We connect to necessary resources. But one of our focuses is reducing preventable ER visits and extended hospitalizations. Our goal is never to discourage our members from accessing the care they seek, but to reduce the level of the care they need by offering early intervention and evidence-based prevention practices. Having direct support from our nurse case managers allows us to connect members with chronic or complex health conditions to intervention and support necessary to manage these higher needs. We can make referrals directly to our physical and behavioral health care managers. And to make it even more cohesive, easier on the members, we actually do joint field visits. The CHW will go out with the physical health or behavioral health care manager and kind of meet all that members' needs at one time. The CHWs are alerted whenever a member is past due for a preventative screening. So we might get an alert that, hey, this member is past due for their colon cancer screening. So whenever I outreach that member next, I can mention it to him, and we've already built a little rapport, or he already knows me, and I can go in and say, hey, I see that you're past due for this. Are you still established with your primary care provider? Would you have transportation to get there and somebody to bring you home? Do you have childcare? It's really just addressing these gaps early on. That way, we kind of know what's going on when the members like, I couldn't schedule a colon cancer screening because of XYZ. We've addressed that prior, and we're already working towards that goal. Next slide. So field work, us as health payer CHWs, we are not stationed in any specific office or a specific location. Instead, we meet our members where they are, and we complete field visits at any location in the community in which both the member and the CHW feel comfortable. So some common locations would be members' homes, public libraries, sober living facilities, hospitals, parks, homeless shelters, food pantries, all of our good community-based organizations, we're usually hanging out there. Next slide. All right, one of the most important benefits of field work in a non-traditional setting is the ability to build rapport. By engaging with the member in familiar environments, the CHW can build trust in a way that might be more difficult over the phone or in an office. For members who are unhoused or who have limited transportation, meeting at a location that is easily accessible to them allows us to provide the member the same level of support as someone who is not dealing with housing insecurity. The CHW can close gaps more effectively when meeting members where they are. Members often feel more comfortable sharing honestly when they are face-to-face with the CHW. One of our current pilot programs focuses on field visits with members who are inpatient at the University of Kentucky Hospital. The CHW can meet with the member before discharge to assess for gaps and provide resources. The CHW will then schedule a follow-up visit after discharge to ensure that the member's SDoH and health needs are being met. The CHW usually works closely with our post-discharge care management team to provide comprehensive support to the member. A recent example of this is a member I met while she was inpatient at University of Kentucky Hospital. I was able to get an idea of her needs before she discharged, and I mailed out a resource guide to her home address. So whenever I did the follow-up field visit after she was discharged, her, myself, and her husband were able to sit down, go through the resources together, and get any appointments scheduled for them. I was able to map out where their local farmers market was, and we had already built that rapport while she was in the hospital, so she was comfortable with me coming to her home after. Fieldwork also opens lines of communications with local organizations and resources in the community. Meeting with members who are staying at homeless shelters, for example, allows the staff members at the shelter to get a better idea of what services we have to offer so that they might refer members to us in the future. I usually leave a little stack of cards and say, if you know anybody who's on Humana, send them my way. Next slide. So I would like to share with you a couple of our recent success stories. This is a member that I personally worked with. This member was a 45-year-old woman who had been street homeless for multiple years. The member had multiple chronic health conditions and was consistently getting her belongings, including her medication, stolen. I outreached this member originally on the phone, and she kind of told me her phone was spotty, it went in and out, but I found out where she was staying. She was staying at a park downtown, and I asked if she would meet with me at the public library. So I met with her at the library, and she opened up to me about having a general distrust of the helping system due to being promised so many things that were not delivered to her in the past, or she would call people and they would say, we're going to call you back, and nobody called her back. So I validated this member's feelings, and then I educated her about resources in her area, but I also said, I understand how frustrating this is. I have somebody directly I want you to call. I had already built a relationship with an agency that did housing vouchers in our county. So I was able to provide her with a direct name and extension of my contact at this agency. And I really encouraged her to reach out. I said, I know it's frustrating calling over and over again. Please reach out to this guy and he can get you in for an appointment. While we were at the library, I also provided her with a list of local food pantries. We sat down on Google Maps and we mapped out how to walk there. And then she agreed to let me do a referral to nurse care management for her so she could get some assistance with managing those chronic health conditions. And she did. She contacted the agency I provided. She was able to get an appointment within days using that direct line, and she was approved for her housing voucher due to her history of housing insecurity and her chronic health conditions. She also completed enrollment with our nurse care manager and is now able to focus on her health, knowing that she will soon have housing. Next slide, please. All right, and then this one is a success story that one of my teammates shared with me. So this member was a 53-year-old male who was living with friends due to not being able to afford housing. The member was in the process of applying for disability due to some health conditions. So our CHW was able to enroll this member in our Samaritan pilot program, which is a new pilot program that provides financial assistance to members working on set goals. So when the member completes a certain goal, they are provided a set amount of funds on a prepaid card. This CHW met with the member outside of where he was staying, right on the sidewalk, and they completed paperwork, and she ensured that his prepaid card that was provided worked. This member then expressed to the CHW later that one of his main barriers was that he had a prepaid phone that would run out of minutes every couple weeks. He had been using his financial assistance that he was getting through the Samaritan program to pay for food, and he didn't have any funding left over to put towards housing or towards his phone bill. And as I'm sure most of you guys know, having a phone is very important when you're trying to get housing or you're trying to get resources, you're trying to stay updated on your housing, voucher applications. And so what this CHW did is, first of all, she educated him on local food pantries. So he expressed that he was spending all this money on food, and she was able to get him connected to food pantries in his area where he could go get food there and kind of allocate that funding towards other things. She educated him on how to get signed up for a housing voucher, how to put an application in at his local housing authority. So the member was able to do those things. And then she started a campaign on the Samaritan app, which is really cool, where she was able to put in a little about his situation, about how this gentleman needed money to put towards his phone, that he's working really hard on his goals. And she actually raised over $200 on that app to pay for this member's phone bill. So now he can stay connected, he can hear the status of his housing, and they are still working together. She is still working with this member on ongoing goals. Next slide. Okay, so we're going to do a little practice scenario, and this is based on one of our success stories. So if you guys want to tell us in the chat how any questions, comments, concerns, anything you think as we go through this scenario, feel free to put it in the chat or come off mute, but I'm going to go through this real quick and then we can kind of get into it. So the scenario is you have a member, she's a 53-year-old female. She called in and requested assistance with her electric bill. On the initial call, members stated that she did not feel comfortable discussing too much over the phone because people in the home were listening in. What are some options that we could offer to this member? You want to put it in the chat or come off mute? I'll give you a couple minutes. Set up a home visit, meet in the community. Yep, exactly. Exactly. That's exactly it. And that's something that's, we're in a really good place to do is that, yep, transportation, meet in the community, call back later. Call back later is a good thing too, because you may ask, is there a time that people won't be around that we can speak openly and honestly? Absolutely. Okay. So you sit down with this member and she reports to public library. Yes, I love the public library. I just saw that come in. I'm always hanging out there. Create trust. Yep. Set up a home visit or a call. Perfect. These are great, guys. Exactly. So you meet with this member and she tells you that she has gotten behind on her utility bills partly due to having multiple chronic health conditions. What would you want to assess for and what referrals would you offer? and I'll give you a few minutes. You guys did really great on the first one. Yep. We love LAHEAP, low income energy assistance. Okay. And then while completing your SDoH assessment, the member reports in addition to needing utility assistance, she struggles with food and clothing. What would you want to provide this member? Identify family members who are close by. That's a good call out. Yeah.
Absolutely. Food pantries
Food pantries.
and vouchers for sure.
Vouchers, yeah.
Absolutely.
Yep. Not to be cheesy, but food pantries are our bread and butter. We love them. Food pantries. Yep. Meet her at a PCP appointment. Yeah.
Absolutely.
Yeah. Fantastic, guys. Yep. Absolutely. Christy, maybe where her money is going is she paying too much for prescriptions and can't afford food for this reason. That is an excellent call out. Absolutely. That's kind of why we do these longer assessments. And one of the things we assess for is, are you having trouble paying for your prescriptions? Local church, clothing pantry. Yeah, for sure.
Farmers market. Absolutely. That's one of our favorites to also mention, especially with that using your food stamp cards, your SNAP benefits. A lot of people actually don't know that you could get those towards food pantry, or I'm sorry, farmers market items, which is a huge benefit.
Yeah, I just saw somebody say SNAP. That's my number one thing I ask is whenever I get a referral on food insecurity, I make sure that they are signed up for SNAP. All right, awesome, guys. You guys pretty much covered it. If you want to go to the next slide, Alyssa, I'm going to kind of talk through what we did. The CHW did offer a field visit at a nearby library. So whoever said public library, you're right on it. That it was in walking distance for the member. Asked the member to bring copies of her past due bills so the CHW could have a good idea of what specific needs the member had. She reported she was past due on bills partly due to multiple chronic health conditions. So the CHW completed a health screening to obtain information on the member's health conditions. They ensured that the member was established with her primary care provider, reviewed preventative screenings, offered the member a referral to nurse case management, and then the member ended up getting connected to a nurse CM who created a care plan with her based on her health goals. Check if she has any collection agencies call her. Yeah, that's good. Definitely. And then while completing the SDoH assessment, the member reports that in addition to needing utilities, she struggles with food and clothing. And you guys were right on it. Ensured that she was enrolled in SNAP benefits, educated on local farmers markets, local food pantries, and clothing closets. And then the CHW assisted her with making an appointment for utility assistance through LAHEAP. And once the local resources were exhausted, we were actually able to come in with that value added benefit that I was talking about earlier, our housing assistance benefit, where we were able to pay the remaining balance on her electric bill. Next slide. All right, so what are some best practices for health payer CHWs? So we kind of talked through a little bit of this earlier, but first off, providing culturally competent care that respects and responds to the cultural needs of all of our members. Building trust, building rapport, establishing trust through consistent and reliable communication, community presence, being visible and active in the community, building those relationships with your CBOs, building those relationships with your resources, your food pantries, all that out in your community, and just kind of being visible. Incentives. So we talked a lot about incentives, but offering incentives for participation, such as gift cards and health-related rewards. I don't know about you guys, but if somebody told me I could get a certain amount of money for going to the dentist, I'd probably go a lot faster than if you said just go to the dentist. So it works. Incentives work and they help everybody. Helps people be healthier, helps support social determinants of health. It's a really wonderful system. Education and awareness, educating the members about the benefits of CHW services and how they can improve health outcomes. I've had a lot of members who I reached out to and they said, I had no idea you guys even did this. I didn't know Humana did this. So part of what we do is try to get our name out there in the community and educate people that we do offer this service to our members, and it's a free service. They can refuse at any time. Just because I call somebody doesn't mean they have to talk to me. It's a totally optional service that we just want to offer for all of our members. And then flexible scheduling. We offer flexible appointment times to accommodate member schedules. We are not set on a like we have to have lunch at this time or we have to do this at this time. We're able to be pretty flexible, meeting our members where they're at, whether that's early morning, afternoon, going to meet them at the park, going to meet them out on their lunch break. Just staying very flexible with our members. And then regular follow-ups to remind member of services, check in on their progress, see if they have any additional needs. And then we always like to say, so health payer CHWs are not designed to work alone. Our goal is to support others who share our same mission. We welcome collaboration with the CHWs who are at primary care provider offices, hospitals, community-based organizations. We love getting emails from CHWs out in the community who are like, hey, I found out one of my clients has Humana. How can we work together? That's always our goal, is to collaborate with people who are within the community. Next slide. And then this is just a quote we really enjoy. There is no thing as a single issue struggle because we do not live single issue lives. All right, guys. And so that finishes up our portion of the session, and we will get into some questions. So Megan, I haven't been looking in the questions. Do we have anything outstanding in our Q&A?
So it looks like we do have one question from earlier where it was asked if each state would have their own Office of Community Health Workers.
I don't know. I'm not sure on that.
And someone did state that in California, they do not.
Oh.
So to my knowledge, it is based on the state. And I believe a majority, if not all, I believed all did have that office, but it's up to the state. And also because of the National Association as well, then you can reach out to them as well for extra resources if that's not something that your state may offer for you.
All right. And do you guys have any additional questions or comments, or if you want to drop in the chat or come off mute?
It looks like there's a couple hands raised.
Okay.
Sunny, are you able to unmute folks?
I do see those hands raised, so maybe if you all could just throw it in the chat, we could probably answer those questions easier for you.
Yeah, that would be great. Not easy when the client
Gotcha.
speaks a different language. Do you want to take this one? Refugees, Megan?
Sure. So looks like I've just got another comment. So we work with a number of refugee patients in our clinics. We use phone and live interpreters and make many conference calls to insurance carriers who do not have CHWs, such as you are. Do you have interpreters other than Spanish? So we actually do also use a telephonic interpretation service in which we definitely will use for every single call in contact with our members. We also do have virtual information that we can provide as well in different languages. And we do have some associates that do speak other languages other than just English. If we did have the availability based on our community health workers, like let's say that we did have one of our associates who spoke Swahili, then of course we would bring them with us, or we would have them go towards those members who do have those different needs. And we do recognize the very diverse languages and cultures that we do serve. And so we do try our best to offer everything that's in their language for what they require. And we do complete verbal risk assessments with this population, absolutely.
Yep.
Yep, thanks for the questions.
All right, if that's it, we really appreciate everybody taking some time with us today. And we will share the slide deck, so we'll make sure that it is sent out. But thanks, everyone. Have a good night.
Thank you all.
Thank you
everybody.
to our presenters. We are going to transition over to the closing session, which will be open at 5:30 p.m. Eastern Daylight Savings Time in about 25 minutes. Great question. We will be closing out this webinar, and please click on the Unity Zoom sessions to join the closing session. The closing session will be at the very bottom of the page for that link to join. I can also put the details here. And once you go into that link, it will ask you to put your first name and last name and email address again. And we'll go ahead and open up that session early now so folks can get in, but you'll be placed in the waiting room until we actually open the session at 5:30. Thank you everyone for attending session 1B. Appreciate your time, and we'll see you at the closing ceremony. We will close this webinar now.